name is Laura Arms. I actually came to, I started seeing Dr. J about a year ago. I was actually invited to one of their Thanksgiving Women's Night Out and talked to him a little bit about my back. I am prior military, and before I left the military, I was having a lot of problems with my back, was getting injections about every 3 months or so, and it was getting closer together. I also was having more problems with my legs giving out. I would be walking along and my leg would just give out from under me, and so I talked to him about that, and we got together, and he has been treating that as and now, I mean, at that time I was taking Norco probably a couple times a day for pain, and now I rarely take it. So it has helped me a lot. I still, if I'm on my feet too long, I still have problems with my leg giving out, but that's because of the nerve damage that I already had prior to him. But otherwise, yeah, I've been doing a whole lot better. I have not had an injection for a couple years now, and my back is doing a lot better. My cervical spine was also out of line, and that is basically back to normal now, except for a little bit of damage that I had prior to coming to see him as well. If you're planning on coming in here to see Dr. J, there should be no concerns whatsoever. I had a hesitation of going to chiropractors because my sisters always went to chiropractors, and occasionally I would go with them, and they did just the large, gross adjustments, and I usually ended up feeling worse after I left them. However, I ran into, when I was working critical care, I'm a nurse, when I was working critical care, I was working with a respiratory therapist who was getting his chiropractic license. And that's when I learned about the individual adjustments to the different vertebrae. And so that's what I have looked for in a chiropractor since then.